This is Dr. Ridha Arem, director of the Texas Thyroid Institute and author of the Thyroid Solution. Hundreds of patients have contacted me and asked about the potential connection between coronavirus and autoimmune thyroid disease. And they wonder whether having an autoimmune thyroid disease such as Hashimoto's thyroiditis or Graves' disease will make them more vulnerable to contracting the virus or having more serious effects from the viral infection. And because of that, I would like to give you my take on these important issues. Having an autoimmune thyroid disease or autoimmunity in general doesn't really imply that you are immunocompromised. That means you are not more likely than anyone else without autoimmunity to contract any viral infection. However, if you have an autoimmune thyroid disease, such as Hashimoto's thyroiditis or Graves' disease, you may, as a consequence, have imbalanced thyroid hormone levels. As you probably know, Hashimoto's thyroiditis is the leading cause of hypothyroidism, and Graves' disease is the leading cause of excess thyroid hormone or hyperthyroidism. Any thyroid imbalance, whether it's deficit of thyroid hormone or excess of thyroid hormone, will cause the immune system to weaken and to not respond appropriately to any kind of infection. This is why hypothyroid patients who are not well regulated with medications, thyroid medications, or Graves' disease patients who have too much thyroid hormone in their system, they tend to have more prolonged infections when they contract any virus or bacteria. Instead of recovering after 3 or 4 days, this may take 2 or 3 weeks. So it is extremely important for any patients struggling with autoimmune thyroid disease, whether Hashimoto's thyroiditis or Graves' disease, to have perfect thyroid hormone levels, to have an efficient, adequately functioning immune system. For this reason, you need to have your thyroid hormone levels monitored and your medications adjusted to make sure that your thyroid hormone levels are in a perfect range, because this is crucial for the functioning of the immune system. We know that thyroid hormone regulates every single organ in the body, and that does not exclude the immune system, which is there to fight for us. Now, let's go back to the autoimmunity issue. I said earlier that having autoimmunity does not make you immunocompromised. However, because you have autoimmunity, you have an immune system that is reactive and sometimes overreacts to any kind of environmental factor. The reactivity of the immune system is translated into the production of excessive amounts of what we call cytokines, which are the inflammation chemicals that the immune system produces that can contribute to symptoms in patients with autoimmune thyroid disease, but also contributes to the systemic inflammation that exists in the body. And we have observed some indication that this virus triggers weird immune system responses that lead to the effect, the clinical effects of COVID-19. So we need to be proactive, because there is no science really linking autoimmunity and autoimmune thyroid disease in particular to specific clinical responses to coronavirus infection. Despite this, we need to be proactive and take care of our immune system, meaning we need to go through all the basic steps that will help the immune system to calm down, to remain quiescent. My first step would be good quality sleep and well-structured sleep, meaning try to sleep at the same time and wake up at the same time, and having at least 7.5 to 8 hours sleep, good quality sleep, is extremely important for the immune system. Number two, I have advocated for years the use of relaxation techniques, specifically to reduce the cytokine production from by the immune system. I have recommended for years the use of meditation, yoga, and Tai Chi. In these circumstances, I would recommend 10 to 15 minutes daily meditation incorporated into your lifestyle, and this will help the immune system to calm down and to remain quiescent. Number three, I recommend that you take supplements, including vitamin D, and keep your vitamin D level at a range of 40 to 60. So have your vitamin D tested, and you need adequate supplementation for that. I also recommend a comprehensive supplement program. I have done this for years for my autoimmune thyroid disease patients to keep their immune system as quiescent and as healthy as possible. The supplement would include zinc, selenium, and many other antioxidants and ingredients that support the immune system functions. ThyroLife Optima, which I have designed myself years ago, that's the supplement that I recommend typically to my thyroid patients, or an equivalent, something that is comprehensive and well balanced. Probiotics are very important, and omega-3 fatty acids are quite helpful for the immune system. I should also insist on the fact that food sensitivities should be considered in trying to maintain an immune system quiescent and healthy. And for this reason, even if you have not done a formal food sensitivity testing, I would recommend you stay away from gluten and dairy. These are the most offensive foods to the immune system in patients with autoimmune thyroid disease. Now, there is another point that I would like to mention, is the connection between a potential viral infection and the occurrence of autoimmune thyroid disease in genetically predisposed patients or people. We know very well that many viral infections have been linked to the occurrence of autoimmune thyroid disease. It's almost like a virus could trigger autoimmunity, and particularly autoimmune thyroid disease. This is illustrated, for instance, by the example of the Graves' disease condition that President Bush had experienced with his wife Barbara in connection with a viral infection shared with their dog Millie. And I detailed this fascinating story in my book, The Thyroid Solution. If you want to learn more about it, you are welcome. And the last point I would like to detail is the connection between coronavirus and thyroid disease as a result of the direct infection of the thyroid gland by the virus. Many viruses can cause what we call subacute thyroiditis. That means it's a direct infection of the thyroid gland that can cause fever and leakage of thyroid hormone from the thyroid gland, leading to hyperthyroidism. That means thyroid hormone excess in your system that may last a few weeks, followed by a state of low thyroid that can last a few weeks, and then potentially recovery of thyroid function. However, there are patients who will continue to have hypothyroidism because of the damage that the virus has caused. So this condition has been described in connection with many viruses, and recently the first case of coronavirus causing subacute thyroiditis has been published by Italian doctors from Pisa, Italy, and that shows that this virus can also induce another type of thyroid condition called subacute thyroiditis. So in summary, there are several points that one needs to think about, and research will demonstrate in the future perhaps more connections between this virus, clinical responses in patients with autoimmune thyroid disease, and perhaps occurrence of thyroid disease as a result of the infection. Thank you very much.